Two apartment complexes are the focus of a community effort to bring services to those living in some high crime neighborhoods. But the nonprofit behind the effort says it's being hampered by federal regulators. Joining me now to discuss this is Paul Tutwiler. He's the CEO and executive director of the Northwest Jacksonville Community Development Corporation. Good morning, Paul.
Good morning, and thank you for having us.
Thank you so much for being here. So, these addresses may not be immediately recognizable, but these complexes have unfortunately been in the news quite a bit for a variety of reasons. Um, mold, crime, conditions. What is the interest? Why does the Northwest Jack CDC want to acquire these properties?
Well, we're not going to be the owners. Actually, we provide social services for the owners who are proposing to purchase the units that you're talking about. So, just a point of correction.
Sure.
We're very proud to be able to provide social services with the New Hope Homes, formerly Hilltop Community, and it's made a tremendous difference in terms of being able to lower crime, build community just morale generally. The owners have done a magnificent job of rehabilitating units, but it's not just fixing up units that drive community change. It's about actually working with the residents. And so whatever the issues are that prevent the ownership transfer from occurring in the subject units that are proposed to be purchased, we're unable to start the programming that we currently enjoy with New Hope Home.
And is New Hope the same agency that's going to be taking over these two properties that we're talking about, University Plaza and Vista Landing Apartments, or would it be a different ownership?
Same ownership, but just the name of formerly Hilltop is New Hope Homes, and they will have their individual names as well, probably renamed, start over, give them a whole new image, and excite the residents.
And so they bring in the Northwest CDC to provide services and to kind of connect with the community. What kind of services specifically?
Well, we are very excited to be able to work nutrition, financial literacy. Some of the residents are already trying to clean up their credit so they can buy homes. Sometimes they come to us in confidential ways or going through domestic issues, so we're working with them to help stabilize their lives. Children see this activity and model it later in life. So we're not the managers. We're not the people that's going to be hammering them with just the regular landlord issues, but we're more sensitive to help them understand some of the challenges so that they can go beyond their circumstances to improve their life. And we're very proud of that because we understand just from working in the community 23 years, they're part of our, that's the next generation. It's what they see, it's what they grow up to become.
And so your effort right now to be a part of this transition for these two properties, and we should say they're both kind of near UF Health in the Hogan's Creek area. What is happening right now? You are trying to help be a part of that change and be a part of that ownership transition, but there's a holdup right now.
Yes, somehow through regulatory issues that I'm unfamiliar with, the transfer has not occurred, and this has lingered, I think, for a few months. We've actually prepared staff and hired staff to go in and start the working, but they don't own it, so we can't begin. So we had to put all those efforts on hold. In the meantime, I think there was a less than nice article that ran that described particularly University Plaza area as one bloody block. It just had a history of violence and crime, and we can't just ignore those issues away. And the ownership is transferred a couple times. I think the difference is not just coming in and rehabbing the units and making them nicer, but working with the actual residents within those units to make the transitions that are required. That is the difference that we propose is needed, and it works so far. And we're very proud to be able to try to replicate the successes that we began in New Hope Homes.
And so the regulatory agency at issue here is the housing, the Federal Housing and Urban Development.
Correct. They oversee all of the HUD properties that receive dollars directly from HUD on behalf of these very low-income residents.
And so do they have to, they're like a gatekeeper, they have to approve the sale or?
Absolutely.
Okay. And so right now you said you were staffed up, ready to affect this essentially like in March or so?
That's correct. We began the engagement. We understood the owners were excited about our work, very pleased with the work we're doing, and asked us to expand with their proposed purchases of two different complexes. And we were like, excellent, we'll be able to do what we do. And unfortunately, we hit a roadblock, and we've been on hold for a few months now.
And so who is able to get answers about that? Is that something that your agency is able to deal with HUD, or because you're not the ownership group specifically, you kind of have to defer to them?
Exactly. So we do what we do on behalf of the residents. We are not in control of either the government or the owners. We work with the residents and we advocate on their behalf.
But you're here today. What is it that you would like? What word would you like to get out in terms of the efforts that you're making to seal the deal here or to get some momentum?
First of all, we're very excited that what we're doing is actually working. It's about understanding that the community for many, many years have gone through a horrible image. Breaking news from the north side. It's just not a very good, positive image. That we're doing some positive things that is affecting change. There are new people choosing to move to our north side community. They're purchasing homes. We're reinventing ourselves and our image. We need to make sure that we're preserving these units for future low-income residents so that they'll be able to come in and become part of the future of the same community in a positive way.
Is there anything, though, that listeners or people, lawmakers, locally can do to help out?
I'd like for them to inquire, what's going on? Why isn't it happening? We certainly don't know. What we're proposing to do is, hey, we are ready to work with our residents, and they're actually calling us. We're not working there yet, but we're excited that they've reached out and asked us to come out. And there's summer camp programs that we're doing. We're doing nutrition programs. We're doing financial literacy. We're doing a lot of things with the residents because they're asking. They want change. They want things to be different and not the same old, same old. And we're excited that we can offer those opportunities.
Well, Paul Tutwiler, thank you so much for coming on today. We hope that you'll keep us abreast of, developments on this and let us know when that transition does happen.
Thank you so much for hearing us, and I'm excited to be here, and thank you.
I appreciate it.